start the program today with something which perhaps all of us know by now, but so important to highlight. With 1 in every 7 Indians grappling with mental health issues, the silent battles of mental illness affects millions. We all know that by now. It could be anxiety, depression, sleep disturbances, all becoming all too familiar. And October 10th now marks the World Mental Health Day. So we thought we'll get a head start on this one. This year's theme for World Mental Health Day is actually focus on mental health in the workplace. Rings a bell, right? Something all of us can really actually relate to. Tragic cases like Anna Sebastian from EY, whose death was linked to work stress, sparked major controversies across the country. But unfortunately, it's not an isolated case at all. And it's also not a problem that has an overnight solution. But we can try. Try to turn empathy into action, urge individuals, communities to advocate for mental health and well-being in workplaces towards a better future. Every voice could be heard, every struggle acknowledged, and perhaps every life can truly flourish as well. But how will this happen? Well, here's an alarming fact for you. India today has 1 psychiatrist for over 2 lakh people. There are just about over 3,000 clinical psychologists registered with the Rehabilitation Council of India. That's like a RCI registration that they need. And according to Indian government's own figures, at the moment in the country, we need around 13,000 more psychiatrists. So how will this gap be met? Is tech a solution perhaps? Well, we'll explore all these questions on the TBC this morning. So let me bring in our guests now. Joining us are 2 of the country's biggest players in the mental health space, and they are mental health providers as well. First up, let me introduce Ramakand Vempati. He is a co-founder and president of Vyasa. Vyasa is a mental health app. It has a startup which works over for 6.5 million people, and they also boast of being international. They are across several countries, in Singapore, in UK, in schools in Scotland as well. And also they pride themselves of being the first AI-based mental health app to be compliant with the NHS standard of clinical safety. So lovely to talk to you, Ramakand, this morning. Also with us is Dr. Amit Malik, founder and CEO of Amaha. Amaha Health operates in 3 physical centers. They are located in Mumbai, they are in Delhi, they are also in Bengaluru. And they have a team of over 150 therapists, psychiatrists as well. And they have a lot of corporate client base as well. So important these days to actually manage things at work. And the point to note here with Amaha is they actually started as being a tech-forward platform, and then they sort of switched back, going back to physical centers. So I'm very keen to understand what the learnings were over there. But let me, on that note, give the first word to Ramakand then. Ramakand, help us understand this. We look at tech for a lot of solutions in today's world. We are in the world of AI. It's very likely that mental health, which has a massive gap in trying to meet with the requirements of the day, will have a tech solution as well. But I dread to think of how mental health issues, which study after study say are injected or come to us through on-screen presence, there is going to be another screen which will perhaps solve this problem for us. So give us an understanding.
Thank you, Sondra. Thank you for having me here as well. You're absolutely right. You go back and say, hey, there's an app for everything. And is there an app for mental health? Do you need an app for mental health? I think that's the big question which most people ask when I start talking about what we do. Vyasa is, it came out of personal need. So I think we ourselves in our friends and family network struggle with depression, with suicide. And also we realized that, like you very rightly mentioned, access is a huge issue. So in terms of the number of people whom you can, even if you with all the will and all the resources in the world, you're not able to, for a variety of reasons, including sometimes it's cost, sometimes it's stigma, sometimes it's lack of awareness and knowledge. And because of all these reasons, even if you wanted to go out and reach out for help, one, you don't know what to reach out to help for, and second, you don't know where to go. And we struggled through that ourselves. Even though we had all the access and resources in the world, When you have depression, it's very hard to get out of bed. So how are you going to go and see a therapist? Drive, park, go. In the workplace, if the therapist is sitting in an open cubicle, you can't go into a cubicle and then in front of your co-workers or your managers, you're scared your manager will find out. So there is a place for a tech solution which is discreet, which is available when you need it, where you need it. 3 in the morning, you want to talk, your family is not around, your therapist is not around, but you still have all these thoughts in your head. So how do you get them out? And it needs to be affordable, and it needs to be available at a place and at a time where people might need it and they may not have the ability to go out and reach out for help. So it is not a replacement and should not be a replacement for a human being, but it is, if you think of it like a funnel, you're actually expanding access 10 times by offering this on a mobile phone. And what Visa does is it creates and delivers a therapeutic intervention, creates a safe space for people to talk about what's bothering them using an AI conversational platform or an AI chatbot. So that's what we do. And now, like you said, 6.5 million people across 100 countries have used this. It's rated 4.8 on the Play stores. So a lot of people have told us that this helps. But at the same time, you do need to connect this to human beings. You do need to connect this to human services. So the solution is a combination. It's not an either or.
I like that. I like that how tech in isolation cannot help. There has to be human intervention, but perhaps tech can help us identify, and it can be the first foot in the door in a way, or just to get you that window. So that's a good way to start. Dr. Amit Malik, let me bring you in then. What got you to sort of ditch the chatbot and go on to say that, boss, we need to go back to therapy rooms. We need to go back to a room where people feel safe and they can physically come and get some good counseling, some good advice.
So, thank you again, and good morning, everybody. So, I'm a psychiatrist by background, and really the thinking process for us was, how do we build an organization in India that can really solve for people with moderate to severe mental health needs? Right? So how do we actually address the needs of families with moderate to severe depression, with anxiety, with schizophrenia, with bipolar disorder? And we always knew that that will require a hybrid solution. Right? So as Ramakand pointed out, with Amaha, our thought process always was to build the full spectrum. But when we started, we also felt that solving for the access part was very, very critical. So we did start digital, and then as we started seeing traction on the digital funnels and the traction on the digital platform, we then added professionals, and then as our professionals started seeing clients who needed more than just online care and needed to be seen face-to-face or in person, we started opening our clinics. So we now in 6 centers across 3 cities, right? So that's it's been a journey, and so the chatbot and the platform today act as a guide and an adjunct, as Ramakand was talking about, to our clinical services. But the core of what we do is really work with individuals and families across severe mental illness with our professionals across these cities.
Okay. Dr. Amit, let me I have a follow-up to this. I think the biggest issue at the moment with mental health centers and even counseling centers, etc. in the country is the quality of people, the quality of counselors, the quality of psychiatrists, and because there are enough and more people who will sit down for it, but it really comes down to what they are doing at an individual capacity, and there is a burnout at their level as well. The business of mental health has become so huge in the country that somewhere the quality is taking a hit and all of us are feeling it. What is your solution to that?
So, I mean, it's a very good question. That's really a big part of what we do, right? So I come from a background of running large mental health services in the global market. And so really thinking about how do we quality monitor both quantitatively and qualitatively, right? How do we look at numbers and data? And that's where actually technology really helps us in looking at individual clinician performance, but also then how do we look at and how do we build supervision structures at an individual level and at a group level? How do we build care protocols that support practice? How do we take feedback from individual clients that makes us enhance the individual and collective practice is what really a big focus of ours is. So we spend about 50-60% of our effort just looking at our clinician platform, our clinician information, our clinician data, we have set up sort of 3-tier supervision structures for all our clinicians. There's a lot of quality monitoring that happens, right? So and we manage workloads very carefully. So we have a caseload management tool that allows us to make sure that our therapists or psychiatrists are not working more than they should be, that each client is getting the attention they need. So I think on the clinician side, looking at the qualitative, the numbers, and then the stories of how these care is being delivered is very, very important, both at an individual clinician level as well as at a collective level. Then we can, and then getting feedback for that performance at both those levels is very important. And we keep doing that regularly. So we constantly do that, and that's what helps us keep our quality up. Our feedback scores are very, very high. Our outcomes are very good compared to the regular population. So that's how we know it's working. The process is working basically.
Right. Right. I have lots to say actually in this business of mental health which has taken off in the country and the targets that have been set by several companies. We hear horror stories about that every day, and this is a very crucial time for mental health in India, and we don't get it right now, it could sort of boomerang on us later. Ramakant, come in on this. We're at one end talking about the quality of people in the system. On the other, you have chatbots telling you what to do. But give me an insight. So today, if I were to go on the app, and I were to say that, Lay, I had a really stressful day at work, I'm getting palpitation, I'm feeling not really myself. What does the app really do? Is there an algo? Like, give me a snippet of that.
So we have 30 clinicians on staff. So we have 30 clinical psychologists who all help in creating a conversational experience on the chatbot which is safe, which is clinically valid, and which is engaging. So we also have an entire conversational design team which sits and actually creates a chat which doesn't feel as if it's a clinician talking to you. It feels like it's a buddy. So you stay anonymous on the app. So when you download the app, you download Wiser, and you don't have to even give anything about yourself. No name, no phone number. You stay anonymous. I can call myself Superman or Rajnikant and have an entire conversation. And so it at one stroke, it is removing a large part of that barrier for people to come forward and even talk about what's bothering them. We had a story, in fact, about the anonymity and the discreet nature of the service. This lady from a very large IT services company, which operates across 53 countries, so we serve them as a client right now. She wrote in and said that she had an entire session of therapy or a therapeutic conversation while sitting with her family in front of the television, and nobody got to know. So and as you can imagine, that is a huge plus for people to then come back and saying, hey, I actually want to have a conversation. So if you download it, you would do a registration or a sign-up process which doesn't include any personally identifiable information. And then the chatbot starts asking you what is bothering you. And in the situation which you mentioned, there will be a space for you to vent, to talk about. So there'll be a lot of context which the bot will elicit. So ask you lots of open-ended questions and create an entire picture of what is bothering you. And sometimes that itself is enough for people to create for you to create a space to vent and just talk about what's bothering you. Then, depending on what you have said, there are a variety of techniques which can be delivered. So it could be meditation, it could be a mindfulness technique. In some cases, when people have a certain threshold of distress which they've crossed, then you can actually, the bot will even handhold them to go and speak to somebody, which is a human being. So there is an entire process. You can deliver CBT, cognitive behavioral therapy, which is also very well known to work in a self-help context. So there's an entire conversation technique there. I, for example, use it to manage worry and to manage difficult conversations. So there's a technique which the bot will give you where it pretends that it's the other person. Imagine you're having conflict at work and your boss is coming and shouting at you. Now you want to have a very productive conversation with your boss, but you want to rehearse it first. And there is a technique called a difficult empty chair technique, which the bot will simulate the entire conversation and saying, okay, I'm going to pretend that I'm the boss, and let's have the conversation, what's bothering you.
Fascinating.
And then the entire conversation, so you can practice that and then also alleviate your distress.
Right. I think I have time for one more question, and I want to throw it open to both of you. And this is regarding the theme for this year, which is mental health at work. We have enough and more evidence and stories around us at this moment in India. And Anna Sebastian is not the only one, like we said. So in your opinion, and Dr. Malik, you can go first, since you deal with so many of corporate clients, how deep is the understanding of leadership of this issue? Because what we concluded was it doesn't matter what you do on the ground, it doesn't matter how many psychologists you have on campus, on roles, or you have HR which is intruding, till the time the leadership doesn't wake up to it, things won't change.
That's absolutely true. And I think what we see as data is that where leadership is fully aligned and on board and aware is where you see the highest uptake in organizations of mental health support. Right? So it is absolutely correct. And I think the last 4 years, things have changed dramatically. Like I've been doing this for 25 years now. And the last 4 years, it seems like a serious shift in how leaders approach mental health at the workplace. This seriousness which is seen, and that's fantastic, right? So we've done a number of, when we do launches now, we often have the global CEO or the chairperson of the organization in large organizations doing a roundtable to launch the program. Whereas 6-7 years ago, this would be a peripheral priority for the HR team, basically. So I do think things have shifted significantly. And here at Amma, I think what we've also learned is that the case mix has shifted. So what people are presenting with, even in the workplace, are more complex needs and more complex difficulties that require sort of more complex support. I think so that understanding with more evolved teams is becoming more apparent, and therefore we're seeing this massive shift now in the conversation. Absolutely. Yeah.
So I have a slightly
I'm hoping big companies are also included in this. Ramakant, quickly.
Yeah, sorry, I have a slightly bearish take on this, which is that I think demand is exploding. As the new generation is coming into the workforce. Mental health has entered the conversation and people are comfortable talking about it. They also recognize the impact it has on performance. I think companies are struggling to keep up. You have slightly traditional methods of support, like the help desks and the panel of psychologists and so on. Typically uptake or usage is between 1% and 3%. And on the other hand, you have something like COVID, because of which mental distress is 100% or maybe 80-90%. All of us have had mental distress and have had that experience saying, I want to talk to somebody and I don't know whom to talk to. And of course, it was much worse during lockdown. So how do you manage that demand supply, that huge gap which exists? 90% of your people need help, 3% of people are actually taking help. And how do you bridge that gap? So, and I do think, and of course, the tragic incidents which have happened in the recent past, I do think that there is an opportunity for everybody to get together. So the employer, the employees, and maybe representation of employees, providers like us who are trying to solve the problem, and actually get together and saying, look, there has to be a new way of doing it, because what we are doing today is not working. And it is, and we are seeing this in anecdotal evidence. We're seeing this in tragic incidents, which then come and hit the press. And I feel bad for the employer because they're trying really hard to create systems of support, but unfortunately nobody is using them. So what do you do? Is there something else you can do? And I think that's the conversation we really need to have. World Mental Health Day this year, I think, is a great time to start that conversation. And we are very optimistic from that point of view, because now we are having these conversations with employers, with public health systems, with insurance companies. So at least people have started talking about it, but the time has come to do something different.
All right. That's a beautiful note to sort of end this discussion on. Time is never enough when you're talking about mental health, but we'll perhaps take it up more and more. That's our promise on The Breakfast Club, to keep the issue and the discussion alive. Dr. Amit Malik, Ramakand Vempati, thank you both for joining us.
Thank you for having us.